everyone. My name is Sienna Leatherwood. I'm a first-year fellow at the Brigham, and I first want to thank everyone, LFA and Women of Courage and Candace for inviting me to talk today. I'm so excited to be here. As a first-year fellow, my journey with lupus is just beginning, and many of you probably know as much, if not even more, about it because of your experiences with it. On a personal level, my interest in lupus comes from the fact that I have friends and family members who suffer from the disease. So with that, we'll get started. I'm going to talk about the generals of systemic lupus erythematosus, and if at any point I'm talking too fast or anybody has any questions, feel free to let me know. So, what is SLE, or systemic lupus erythematosus, or lupus? It's an autoimmune condition, so this means that the immune system actually attacks parts of the body. It's extremely individualized. I think of lupus as almost like a fingerprint, so nobody's fingerprint is like anybody else's, and people's experience with lupus can be very different from other people's experience with it. It can affect 1 in 2,000 people, and it's more common in women and more common in African Americans. And there's no cure for the disease, but it can be managed with treatment. So how is the diagnosis made? It's interesting because in lupus, there's a difference between the diagnosis and the clinical classification of the disease. The diagnosis is a clinical diagnosis, so you go to a doctor, you discuss your condition with her or him, go over the labs, and they diagnose you with systemic lupus erythematosus. However, in terms of being classified as having lupus, the American College of Rheumatology has outlined 11 different criteria, and if you meet 4 of these criteria, you qualify for the classification of lupus. So these are some common lupus symptoms, and sorry for the blurriness of this photo, but it can really affect any part of the body. So the brain, mouth and nose involving sores, the lungs and the heart, fingers, toes, or tips of the nose. People can have fatigue, you can have problems with your eyes, with your skin, with your stomach or gastrointestinal system, and persistent pain and swelling of the legs, joints, and or feet. So what are some of these classification criteria that the ACR has set out? In medical school, there was a mnemonic called MD Soap Brain that a lot of us used to remember exactly what they were. So the M stands for malar rash, but there's also a discoid rash. People can have photosensitivity, so this is manifested as feeling like you're a little bit sick in the sun, or you get a rash when you're going out in the sun. Oral or nasal ulcers right in the bottom or the top of the mouth or involving the nose. Any blood cell disorders, whether it's low red blood cells, low white blood cells, low platelets. Arthritis, so pain in your joints, and not necessarily just pain in your joints, but also swelling of your joints. Serositis, so that's a big word for inflammation of some of these linings in the body. So the heart sits in a little bit of a sac, similar to the lung. The lung sits in a sac, and if that sac around the heart or the lungs gets inflamed, it can produce pain as well as fluid. And if you have a fluid around your heart or fluid around your lungs, that's called serositis. Renal disease, so a lot of people can have what's called lupus nephritis. Many people will undergo a biopsy to classify exactly which kind of lupus nephritis you may or may not have. And your urinalysis, or when you go to the doctor and you submit a urine sample, there can be some abnormal cells in that urine sample that can be a sign of lupus nephritis. Neurologic symptoms, so this ranges from headaches to fatigue to feeling a little bit of a brain fog, all the way to seizures and other neurologic manifestations, numbness and tingling. A positive ANA, which is a lab marker, so it's a particular antibody that can be found in the blood, and it can be found in the blood in the majority of patients with lupus, although there is a small subset of patients who don't necessarily have this positive lab. And other antibodies, so an anti-Smith antibody, an anti-double-stranded DNA antibody, and anti-phospholipid antibodies. And as a reminder, you certainly don't need all of these criteria to meet the classification of lupus by the American College of Rheumatology. You only need 4 of these criteria as long as it fits the appropriate clinical picture. So what are some things that we can do together and that you can do to help control lupus? How can we take control of the disease? We'll talk a bit about medications, about the importance of a healthcare partnership, routine health screening that can be done, some special considerations, and some common triggers for flares. So, medications. There's a number of medications that people take to control lupus, but the majority of these medications are focused on suppressing the immune system, calming down some of that inflammation so that the immune system stops acting so aggressively towards the body. The important thing about the medications is that they do need to be taken consistently. So every day, some of the medications are twice a day, some of the medications are once a day, and the more medications you take, the more difficult it can be for the timing, but they do need to be taken consistently. As many of you may have experienced in the past, a lot of these medications are not without their own set of side effects. So you have the symptoms from lupus, but then you also can develop some symptoms from the side effects. And that's why it's so important to recognize that this is a healthcare partnership. So it's really, really, really important to have a good relationship with your provider so that if you start to develop symptoms from your lupus flare, or you start to develop symptoms from the medications and you don't want to take them anymore, or you start to feel like something isn't right, or you start to even feel like you're catching a cold, to have a good relationship with your healthcare provider so that those lines of communication remain open. It's also important that the treatment plan that you have has to fit your life. So if you're given a number of medications and you know from the get-go that you're getting medications but you're not going to take that medication isn't going to do anybody any good. So it's important to make sure that you have the lines of communication with your healthcare provider, but also let us know if you know, like, this, I'm not doing it, I'm not injecting myself with this, so don't even give it to me. That's important to know. We've already talked about the importance of open lines of communication. And maintaining awareness of the manifestations of your lupus with early attention to signs and symptoms is very important. So as we've already discussed, two people's lupus can be completely different. Some people may get rashes and joint pains, and some people may get fevers and chest pain. Knowing how your lupus manifests and how it presents itself is important so that we can catch flares early. And then lastly, as we've already discussed, some of these medications do have side effects. So if you're developing side effects from the medications, let us know, because there are other medications that we can try. So what are some routine health screening that's important? Blood pressure, blood sugars, cholesterol, very, very, very important. We know that patients who have lupus have an increased incidence of heart attacks, of high blood pressure, of strokes, and these three things are all other things that can contribute to that risk of disease. In addition, many of you may have already had experience with prednisone or Medrol or steroids. And steroids, we'll talk about those in a moment, but those are not without their own set of issues. And one of these issues is bone problems, so they can make your bones pretty thin. And as we know, lupus affects women more commonly, and women as we age, and certainly after menopause, our bones naturally become more thin. So it's really important to have your bone density checked. Now that's usually done with what's called a DEXA scan. It's kind of a fancy x-ray where you lay on a table and take an x-ray of your entire body. That bone density scan is very important. We need to know if you have early evidence of low bone density so that we can treat it appropriately. So, prednisone. Like I mentioned, many of you, exactly. Oof, no fun, right? Now, we need prednisone because if you have a flare, we have to calm down that inflammation. And a lot of the medications that we use to treat lupus will certainly work, but they take a little bit of time to get going. So we'll use the prednisone as sort of that bridge over troubled water when we need something to calm down the immune system. But they can definitely cause elevated blood sugars. They can definitely cause elevated blood pressures. And if you already have high blood pressure from the get-go, or some kidney disease, or you already have problems with your sugars from diabetes, it's only going to exacerbate the problem. We've already talked about the risk of osteoporosis and thinning of your bones. It can cause, in some, not all, but in some, it can cause some irritability and some mood swings. There's a condition called osteonecrosis where it can affect your bones a little bit differently from osteoporosis, but result in quite a bit of bone pain, and that's after long periods of being on steroids. It can cause fluid retention, so if you already have kidney problems and your legs get a little bit swollen, and then on top of that you're adding some steroids to it, your legs can definitely become more swollen. Another problem can be insomnia. So this doesn't affect everyone, but some people can notice when they take their prednisone, it's a little harder for them to go to sleep at night. Weight gain, so a lot of people notice when they get those steroids on board, their weight starts going up a little bit, and sorry, or a lot, it can definitely go up. And on top of that, you get the weight gain because the steroids make you gain weight, but it also gives you a pretty ravenous appetite. People start noticing that they have to have certain foods and they can't control it. And the last is a risk for cataracts that we usually see with long-term steroid use. So, what are some things that we can do to take control? I can't stress enough the importance of exercise. So we've already talked about steroids causing some weight gain from both increased appetite as well as just causing weight gain in and of itself. Exercise can help mitigate some of that. So it can strengthen your hearts, lungs, bones, and your joints, and we know that these are all places that can be affected by lupus. It can help decrease some of that inflammation. It can control the weight gain from steroids. It can reduce a lot of the fatigue that people feel, and it can enhance your mental health. Now, it's not easy to do exercise if your joints are hurting and you can't get out of bed and you're feeling terrible. But there are some joint-friendly activities that you can do. So low-impact walking, even if it's around the block a couple times a day, even if it's, you have a flight of stairs and you make your way up those stairs an extra couple times a day, anything that you can do to get in some exercise is great. Swimming is wonderful for painful knees. It's low impact on your joints. It's anti-gravity. Bicycling, depending on how those joints are. Some people love bicycling, some people don't particularly care for it. Low impact aerobics to get that heart rate up. Pilates, the stretch in Pilates is actually pretty nice. And the elliptical is that where you are on the thing and yeah, exactly. It's low impact on your knees, it gets your arms going, it gets your blood pumping. It's great. So, a lot of people notice that sometimes, I was feeling so stressed and I felt a flare coming on and there was nothing I could do about it. Stress reduction is so important. And I found this meme on the internet. I thought it was kind of nice. You can't calm the storm, so stop trying. What you can do is calm yourself. The storm will pass. Whether it's meditation, relaxation, getting a massage, having a cup of milk, watching mindless television, whatever it takes for increased relaxation and stress reduction can really help control your lupus. Sunlight. So as we mentioned, one of the criteria for lupus was photosensitivity. So we know that even if you aren't necessarily sensitive to the sun, UV exposure can sometimes precipitate a flare. So everybody should be wearing sunscreen regardless of if you have lupus or not. But if you do have lupus, it's so important to wear sunscreen. Your SPF should really be around 70, and you should apply it to parts of the body even that are covered by your clothes, because sometimes those sun rays can still penetrate your clothes. And wear a hat. A hat can really protect your face from a lot of the rays of the sun. This is a little Boston hat. Yeah, you can get a Boston hat, right? So what are some common triggers of a lupus flare? We've already talked about UV light, certainly infections, and as we've already talked about, a lot of the medications that we're on for our lupus can suppress the immune system, so we're at a higher risk of having an infection. And if you get an infection, whether it's a urinary tract infection, a pneumonia, the flu, a bowel infection, a joint infection, a throat, any infection can put you at a risk for a lupus flare. Sulfur drugs have actually been linked to increased lupus flares. So this medication in particular, Bactrim, is a pretty common medication. If you're on that, just be aware that it can precipitate a flare. Emotional stress, we've already talked about, can precipitate a flare. Being completely exhausted, so if you've been running yourself down to the bone for whatever reason, because you got emotional or financial issues, or somebody staying with you and they're keeping you up, or your neighbor is giving you a headache, or there's noise outside, whatever it is, you need your sleep. You absolutely need your sleep. And then any injury or trauma, so if you were in a car accident or you fell off a ladder, or something happened, keep in mind that can precipitate a flare. I'm getting laughed at over here.
No, falling off a ladder.
I had someone fall off. So cancer screening. Even if you don't have lupus, it's important to do cancer screening. But if you have lupus, it's even more important. Lymphoma is a type of blood cancer that people can get that usually is in lymph nodes, but can sometimes not be in lymph nodes. And it's so important to keep an eye on your routine CBC, and that's just a regular blood panel, so that's your white cells, your red blood cells, your platelets, because lupus in and of itself, and as well as some of the medications that you take, can also put you at increased risk for lymphoma. Breast cancer screening, so we all know we all need to be screened with our mammograms for breast cancer. Cervical cancer screening, so those pap smears, so important. If you smoke, you absolutely need to be screened for lung cancer. Now, that being said, let's talk about smoking. We'll get to it in a second. But you shouldn't be smoking if you have lupus in the first place. So, yes.
My doctor said after age 65, you don't need a pap smear anymore.
Correct.
And then I'm seeing this.
Correct.
So we didn't relate that.
The older, well, so as we get up in age, we don't need pap smear screening depending on what our past history of it was.
So even
But if we're younger women, 30-year-old women, lupus is a disease that affects women of childbearing age. So younger women definitely need to be having their pap smears. Any other questions? Yeah.
I'm actually here because my daughter has it, and she's only 18, so they won't do a pap smear or a mammogram at 18.
Mammogram, she doesn't necessarily need yet. A pap smear, they usually start at age 21, but as she progresses in life, she'll definitely need pap smears. So we'll talk about HPV screening in a moment, but a pap smear is to detect cervical cancer. And cervical cancer is associated with the HPV virus, and that's transmitted usually through sexual intercourse. So they usually say that if you contract HPV, it takes about 10 years for that HPV virus to start having the ability to trigger cervical cancer, which is why they wait a bit of time before starting to do pap smears, because it takes some time for that to occur. That's probably why they're waiting. Yeah.
What about skin cancer?
So skin cancer is an excellent question. That's the important thing is really that you should be wearing sunscreen, but you should definitely be seeing your dermatologist for a routine screen. If you notice a funny looking mole, that has to be checked out. Now, women with lupus aren't necessarily at an increased risk of having skin cancer, but because UV light does affect your body a little bit differently, it's very important to be very cognizant of what's going on your skin. Any other questions? Okay. So we know that there's an increased risk for cancer that's associated with smoking, obesity, hormone replacement, and immunosuppressive agents. So even if you don't have lupus, but you smoke, or your BMI is a little bit higher than it should be, your weight's a little bit higher than it should be, or you're on hormone replacement therapy, you're at an increased risk for cancer. You throw on top of that an immunosuppressive agent like the medications that we give for lupus, and your risk for cancer goes up even higher. So, vaccinations. Vaccinations are a very simple, straightforward thing that everybody can do to improve their health with lupus. So there's two pneumonia vaccinations. The first one is called Pneumovax. The second one is called Prevnar. Now, the funny thing about Pneumovax and Prevnar is that it's great. It's better if you can get the Prevnar vaccination first, because if you give Prevnar first, then you can get the Pneumovax about 8 weeks later. As opposed to if you get the Pneumovax first, then you usually have to wait about a year before you can get the Prevnar. Both of them are important. The next one is the flu vaccination. So every single year, everyone should be getting the flu vaccination. But make sure you get the injection flu vaccination. There's a nasal flu vaccination, but that's a live version of the virus, and you don't want that one. You want the injection. HPV vaccination. So this is a 3-part vaccination that's given to both men and women. It's approved between ages 9 to 26. And the HPV vaccination helps protect against cervical cancer. It's safe and efficacious for lupus patients. One of the problems that can arise with it is that if you're on immunosuppressive medications, it may take a little bit more time for it to take, but you should absolutely have it between the ages of 9 and 26. And the shingles vaccination. Now, the shingles vaccination, is tricky because it's another live vaccination. So not everyone will necessarily be an appropriate candidate for the shingles vaccination, but you should definitely speak with your rheumatologist or your primary care physician about it. Bone health. So we've talked a little bit about osteoporosis. There's an increased risk for osteoporosis in our patients with lupus, especially because of the use of steroids. In addition, we know that osteoporosis arises if we don't have as much activity. And if you have a lot of pain or you have a lot of fatigue and you're sitting on the couch a lot and not moving around a lot, that's decreased activity that can put you at a higher risk. One of the things that we can do is give calcium and vitamin D to maintain that bone strength. And we recommend at least 1,000 milligrams daily of calcium and at least 600 to 800 IUs daily of vitamin D. And it's so important to do weight-bearing exercise because bones are these dynamic tissues in the body, and if we sit around and we don't move around a lot, the bone thinks that it can sort of take a break and relax. The more we move, the more the bone allows itself to sort of ebb and flow and grow and shrink the way that it should. There are additional medications that people can take for osteoporosis. So some of you may be on a bisphosphonate. The most common that we use is Fosamax. And there are others out there. As we get older and we have increased risk for osteoporosis, those medications may be on your medication regimen. And then we've already talked about the importance of a DEXA scan, which is that X-ray to screen for the presence of osteoporosis. Smoking, smoking, smoking. So even if you don't have lupus, smoking is not a good thing. It's associated with increased cardiovascular risk, increased episodes of cancer, strokes, heart attacks, high blood pressure. Smoking is one of the main things that people can do to protect their health. If you're trying to quit, please ask for help if you're having difficulty. I read a figure that said that it takes people on average about 7 attempts to quit before they're actually able to quit. So if you've tried to quit and failed, don't let that stop you. Try again. You've got 6 more times to go. In addition to the increased risk of strokes, heart attacks, infections, and pneumonia from inhaling all of the smoke, and elevated blood pressure leading to worsening kidney disease, there's also increased risk of active skin disease from smoking. So in conclusion, some of the things we've talked about are that lupus is an autoimmune disease with multiple manifestations. No two people have necessarily the same lupus. There's no cure, but some of the symptoms of lupus can definitely be managed with medication. And there are several things that we've talked about that can be done to ensure that you lead as healthy of a lifestyle as possible. Thank you so much for your time, and if there are any questions, please let me know. Yes.